by this way that we are working, we cannot cover the all of subjects. You know what? At first, Dr. Khalid tried to start from his subject till lipid metabolism. After that, he came back. He told me that I cannot cover those subjects, and just I start to summarize the subject. But I think in this situation we cannot cover these subjects too, because you are in a hurry for going home. Okay, about TCA, I told you that it is TCA cycle or Krebs cycle or citric acid cycle. Both. All of them are the same. You can see them here. In this situation, have you ever studied Krebs cycle or not?
Yes.
You studied?
Yes.
You can see, guys, again, these intermediates are not important to me. These intermediates and enzymes are not important to me. Just I want you to know that acetyl-CoA enter the cycle, produce citrate, isocytrate, alpha-ketoglutarate, succinyl-CoA, succinate, fumarate, malate, oxaloacetate. I wanted you to know just this acetyl-CoA enter here to produce NADH and FADH. Why these are important?
Because they are constant.
Because they start the electron transportation.
They want to produce energy for us in electron transport chain. You asked me about the complex 2. You can see here that complex 2 and 1 is involving Krebs cycle 2. But here it can pump proton, but it cannot because of the structure. Because of the structure, just transfer electron. Guys, here you can see the accumulation of Krebs cycle and electron transportation. It is just for your better understanding. And about citric acid cycle, the final common pathway of oxidation of glucose, amino acid, and lipids is citric acid cycle. All of the cells have citric acid cycle. Guys, do you know that which organ in our body is so active metabolically?
Lungs.
No.
Liver.
Liver. Liver is like our factory in our body. Lots of metabolic pathway occur in the lung. In the liver. In the liver. And when the enzymes be deficient in citric acid cycle, because the energy producing stuff, again we will have neurological damages. Am I right? Guys, again, it is related to citric acid cycle. Just I want you to concentrate the production of NADH and CO2, NADH and CO2, GTP production, 1 GTP, and FADH2 and NADH. It doesn't need to memorize the cycle and the intermediates. You should just know about the production of NADH and FADH2. And about the role of that, I told a lot, guys. Some amino acids convert to the intermediate of Krebs cycle. If we can focus on amino acid metabolism, inshallah, tomorrow, you will see that some amino acid will convert to pyruvate, some amino acid will convert to oxaloacetate, some amino acid will convert to succinyl-CoA, and some intermediates. On the other hand, these intermediates can convert to amino acid. Glutamate is an amino acid, am I right? Glutamate or glutamic acid. It can convert to glutamate, or in some situations, it can, for example, oxaloacetate can convert to glucose. I will tell you in this session if I can. And this is the intermediate and amphibolic process. What does it mean? oxidative process like producing NADH, FADH2, and also synthetic process of producing glutamate or glucose. Do you know why I cannot memorize you? Because you are like this. Be comfortable. I was just struggling in my mind why you are. Be comfortable. It's okay. Guys, we had glycolysis, we had Krebs cycle, and now we wanted to explain about glycogen metabolism. Again, glycogen metabolism have two parts. Glycogen synthesis and glycogen breaking down.
What's
Do
the
you know
difference?
what we named them?
What's the difference?
Anabolism and catabolism?
Huh?
Anabolism and
Anabolism and catabolism, it is glycogenesis. Genesis means producing, and this is means glycogenolysis. Am I right? Lysis, breaking down. Genesis, synthesis. Did you get the point? And now you can see here, glycogen metabolism can dissociate in two parts, glycogenesis or glycogenolysis. Glycogenolysis means that glycogen breaking down to glucose. Guys, when phosphate attached to glucose, it cannot excrete from the cell. It is sequestrated. It is like in the prison of cell. The phosphate should be dissociated from glucose till it can go to blood circulation.
So it will be back to glycogen to be a bondage of the phosphate.
Glycogen start to breaking down to glycogen 1-phosphate. After that, we convert to glycogen 6-phosphate.
And 6-phosphate it can go out.
No.
Count.
If the cell have the enzyme for breaking down this phosphate, like liver, it can release these to blood circulation, guys. But muscle cells doesn't have these phosphatases. And this glycogen, glucose is just for itself. Muscle just. We have two parts that have glycogen storage, liver and muscle. Am I right?
Yes.
We have near to 1 kilogram glycogen storage that it will remain for 12 to 18 hours.
Okay.
After 12 to 18 hours, we don't have glycogen anymore if we don't have again
Glycogen.
food intake. Okay? And the liver has phosphatase that convert glycogen 6-phosphate to phosphatase. The liver has this phosphatase, and this glucose will enter the blood circulation. For what? For nutrition, for producing ATP, for having energy, for nerve cells, for RBCs. But in muscle cell, we don't have these phosphatase. And these glucose 6-phosphate just produce energy for muscle itself, not for entering to blood circulation. Did you get the point?
Yes.
It is so important to memorize it, I tell you. And this is the glycogenolysis that glycogen convert to glucose, and the opposite direction is glycogenesis that glucose convert to glycogen. Okay? It's not important, guys, to know about. If you want, I can explain you guys. final exams. Guys, about glycogen synthesis, I've explained all of them. Yeah, I've explained all of them. And it is the thing that I told you about the
Glycogen storage in our body.
exactly about glucose 6-phosphatase, that the muscle doesn't have this enzyme, but the liver have this enzyme. That's why the glucose from the liver enters the blood circulation, but from muscle it cannot enter the blood circulation and produce energy just in muscle itself. It was related to this and because you're a physiotherapy student and you need to know about the muscles. It is so important to you. We have some abnormalities that we call them glycogen storage diseases. What are these? The enzymes that have involved in glycogen synthesis or glycogenolysis, maybe they have been mutated or have mutation. In this situation, maybe we face with liver damages, muscle weaknesses, and early death. These abnormalities are listed here. It is just for your information. It doesn't mean, guys, in Iran, we have these abnormalities that the babies come to the clinic in children's hospital and they have their sample and send and have actually diagnosis for these abnormalities. And in some situation, maybe some supportive and some prophylactic medication can help them. But there is no other exact treatment for them, just it is prophylactic treatment.
What's the difference between glucose 1-phosphate and 6-phosphate?
It is the place of phosphate that you can see here. I should come. I told you that you are in love with detail, subjects. You can see here glycogen, and first the phosphate is in carbon 1 of glucose. The aldehyde carbon of glucose is carbon 1. Another enzyme that we call them isomerase. It transfers the phosphate from glucose 1-phosphate to glucose 6-phosphate. Why? Because it wanna enter the glycolysis for producing chloride and acetyl-CoA. It is related to metabolic pathway. If you wanna in detail, I will tell you. Okay? Did you get the point? Guys, have you ever heard about gluconeogenesis? It is so noisy, you know? Can you hear?
Yes.
I don't know what is happening here. Guys, gluco means glue. Neo means you can guess, I know. You're so smart. Higher, louder. And genesis means
Production or repeat.
guys, it means production of glucose from non-carbohydrate substances. Non-carbohydrate substances convert to glucose when we are in fasting state. We have limited glucose, but what is happening to our brain that is totally dependent to glucose? Some other product can convert to glucose, like pyruvate, like propionate, like oxaloacetate. I will tell you. We call that gluconeogenesis. It is exactly what does it mean?
The glucose can change to provide by glucolysis, and vice versa. The provide change to glucose by glycogenesis.
Gluconeogenesis. Guys, this pathway I will show you that this pathway I told you about lactate, propionate, and glycerol that they can be substrate of gluconeogenesis, and the major tissue is liver and kidney. Just for your information, at first I want to show you this process. Glucose can convert to pyruvate. Okay, some of these enzymes can work in the opposite direction, but some enzymes cannot work in opposite direction. Again, I want to come back to glycolysis pathway. Guys, do you see this part that this reaction is bidirectional? Is not bidirectional.
Reversible.
This is not reversible. This pathway is catalyzing by one enzyme and this direction by another enzyme. Okay, but this pathway is reversible. Again, this is not irreversible, but this is reversible. This is irreversible. This reaction and this reaction is not reversible.
Because the enzyme is different.
Exactly, the enzyme is different, and in gluconeogenesis, this enzyme that is in the under part of the arrows will working. And again, this is reversible, this is reversible, this is reversible, but it is not reversible. It is done by two different enzymes. I will tell you that pyruvate can convert to phosphoenolpyruvate. These three steps is replaced by another enzyme in gluconeogenesis that I will show you. You can see here this part, glucose 6-phosphatase, fructose 1 and 6-bisphosphatase, phosphoenolpyruvate, carboxykinase, and pyruvate carboxylase. It is the substances that cannot convert by those enzymes in glycolysis. Did you get the point?
Yes.
Some special enzymes for gluconeogenesis be needed that they are working to produce glucose from non-carbohydrate precursor. And about I told you about it, and also I told you that in fasting state, gluconeogenesis is a subject, actually a source for glucose production in nervous system and erythrocytes. And after overnight fasting, at first we have glycogenolysis. Okay. After that, when the glycogen storage decrease, we have and deplete, we have gluconeogenesis. And depletion of glycogen reserve, we have gluconeogenesis. And if the enzyme be deficient in this pathway, usually they are fatal. Why? Because they cause to hypoglycemia, brain dysfunction, and finally coma and death. And I told you about these are not important so much. And you should know that gluconeogenesis help to depleting lactate and glycerol, where in anaerobic glycolysis we had high levels of lactate. Am I right? These lactate can consume in muscle cell and erythrocytes for gluconeogenesis. And the amount of that won't be increased in muscle and erythrocyte. It is harmful. Why? Because it is acid, lactic acid or lactate. If they cannot clear from the erythrocyte or muscle or blood circulation, our body will face with acidosis, means decreasing our body pH. Okay? And the glycerol that produced from adipose tissue again can convert to glucose. Glycerol and lactate will convert to glucose through what? Gluconeogenesis. It was related to gluconeogenesis. I told you about them. Again. Guys, our body, insulin and glucagon, working hard to balance the blood glucose. Do you know the normal range of blood glucose?
You mean the sugar in the blood?
Yeah.
180.
Less than 100 is normal, okay? Less than 100 is normal. It is based on millimole per liter, but 100 is based on milliliter. Milligram per deciliter, okay? The blood glucose less than 100 milligram per deciliter, in some differences say from 50, some differences from 70 to 80 to 100 milligram per deciliter. It is in normal situation. But if the amount of that be more than 100 milligram per deciliter, it is
Diabetes.
diabetes. In some situation less than 126, we call that pre-diabetes, and more than 126, we call that diabetes. It depends on the test. They should, the patient that is suspicious for diabetes should go to the laboratory and have a glucose solution and have a test under the name glucose tolerance test. Have you ever heard about that?
Yeah.
What is that?
Lactose intolerance, when you can digest milk and its components.
Not lactose intolerance, glucose tolerance test.
Means test glucose in different time and different days and collect all that tests and
Somehow.
know if the patients have diabetes or not.
Somehow you are near to that. I will tell you about adverse glucose tolerance test. I will tell you. Guys, in the laboratory we call that GTT. What does it mean? For example, I go to the laboratory and my blood glucose was, for example, 110 milligram per deciliter. Okay, I am suspicious to diabetes. The doctor asked me to again go to the laboratory and have GTT test. What does it mean? At first, we will have a test when you go to the laboratory after overnight fasting. After blood collection, they will give us a solution of glucose, pure glucose, based on our weight. For example, for my weight is about 70 gram glucose in 400 milliliter water. Okay, after drinking that solution, 1 hour later, 2 hours later, and 3 hours later, they will collect my blood again in that day. And in normal situation, at first my blood glucose increased till 140 milligram per deciliter, and after that decreased to normal range after 3 hours. But in diabetic situation, you can see that curve, that it is higher than normal at first and also decrease later than normal. Did you get the point? It is glucose tolerance test that I explained you. I told you about this, and I told you guys, for example, a person have diabetes, okay? Can we just give them insulin in every dose and every situation?
No, it's depend on the situation.
Okay, we should be careful and follow because the danger of hypoglycemia is increased in insulin, actually insulin consumption. When the hypoglycemia occurs, what is the dangerous option of that?
You can have brain
Unconscious
shock,
death.
I think. Brain death or brain shock because
Exactly.
your brain needs glucose.
Exactly. We have the danger of coma and death.
Unconsciousness.
Unconsciousness, yes, exactly. And it was about the blood glucose that I told you that I told you at first that galactose, fructose, and all of them was converted to glucose, and also tell you about all of these issues. Guys, besides lactate, pyruvate, and glycerol, some amino acid can convert to glucose too. If I be alive, inshallah, tomorrow I will introduce them to you. Some amino acids will convert to glucose. Okay? They are glucogenic or work on gluconeogenesis. Guys, this is related to insulin and glucagon. Do you want to explain about the mechanism of that or not? Absolutely not, yeah?
We explain?
No,
We don't need
As
it.
you
right?
want.
We don't need it.
for example,
Yes?
As you want.
okay. Guys, just I don't want you know about the mechanism. Just I want you know that glucose decreased by insulin and increased by which hormone increased the glucose?
Food.
Hormone. We have two hormones that regulate glucose from pancreas.
Yeah.
You only know insulin now.
Just insulin. Insulin from beta islet, and we have glucose.
Glucagon.
Glucagon. When we are in fed state situation, we have insulin for what? For decreasing blood glucose. And when we are fasting, in fasting situation, we have glucagon to increase the glucose production by different way, by activating glycogenolysis, by activating gluconeogenesis. Okay, did you get the point? Insulin and glucagon is two hormones that actually regulate the glucose level. It is like balance that you can see here. Glucose, insulin, decrease the glucose, and glucagon increase. When we are in fasting situation, and here when we are in fed state. Did you get the point?
Yes.
These were related to the hormonal regulation of glucose. I'm confused. I know. And about clinical aspects, guys. Our blood glucose is normally less than 100. And when we start to having and eating food, our blood glucose increase to 140 milligrams per deciliter. But what is happening when it increased till 180 milligrams per deciliter? What is happening in diabetes? Guys, it will pass through our glomerulus. Do you know what is glomerulus? kidney cells,
Yes.
yes, nephrons,
Yes.
and the glucose will pass through the nephron cells and enter the urine.
Okay.
That's why that diabetic patient have positive glucose test in their urine. Why? Because the renal threshold is 180 milligram per deciliter. If the blood level of the glucose be higher than this, it will enter this urine. And we name that glucose urea.
It's glucose urine.
In the urine, what does it mean? Proteinemia.
Protein.
Protein
Protein in the blood.
In the blood, proteinuria, protein in the urine. And this means that glucose in the urine when in diabetic situation. And guys, hypoglycemia may occur during pregnancy, in neonates, especially when they have born and they don't feel in the appropriate time, they will be hypoglycemic, and all of the nurses should be careful about that. On the other hand, I explained you about glucose tolerance test and guys, the gluconeogenesis produce a high amount of energy. Okay? That process that I showed you need a lot of energy. That's why when you start to decrease carbohydrate in your diet, your body have to do gluconeogenesis, have to consume other source of your body to produce glucose. And that's why you will have a good weight loss. That's why when you restrict your carbohydrate diet because of gluconeogenesis and some beta oxidation, you have a good weight loss. Did you get the point?
Yes.
Okay. And guys, have you ever heard about favism? G6PD deficiency. شما دوست عزیز ایرانی شما فاویس میشناسید؟ باقلایی میشناسید؟ Have you ever heard that some people that eat something like favabi or maybe some other product, they start to become yellow, become jaundice? Do you know jaundice? The skin start to become yellow, and the eye, the white part of eye start to become yellow. عربي چی؟
واحد من ياكل في الاكله.
Hepatitis?
In baby when they born.
Doctor, what kind of food exactly?
Jaundice.
What is jaundice?
أبو صفار.
كده بنتاكل.
When he eats
أبو صفار والله صحيح.
كيف العادة
يرقان.
يرقان معروف ايضا بالصفارة ولا
You tell that يرقان? يرقان.
شنو؟
Okay.
يرتفع بسبب ارتفاع مستوى ما حكى.
What do you call that in Iraq? You don't have the baby. Abu Spar. Good. Asfar Elizar. Abu Spar Good. Anyway, this is I want to introduce an abnormality. So it is more prevalent in boys, but there is in girls too. But it is more prevalent in boys because it is X-dependent. After that, because the red blood cells don't have these NADPH, the red blood cells start hemolysis or hemolysis. What is hemolysis? The disruption of RBC. The RBC will disrupt it. And when they have the coagula, and some special drugs, their RBC start to be lysis. Their RBC start to be ruptured, and they will be in Yaraghan situation, jaundice, and we call that favism. In Iran, we have these screening tests for newborns, G6PD test. We have these screening tests for neonates to know if they be positive for these abnormalities. In their history, the doctor will tell to the family that you should be aware when you refer to doctor, say the doctor that my child is G6PD deficient or favism. Why? Because they cannot use some of drugs like Primakin, like sulfonamides, and other things. Even, do you know about?
Doctor, does it just affect the color of the cells or also the shape of it?
About RBCs?
Yes?
Not the shape.
Just the color.
They don't have enough NADPH, and based on this process, NADPH is essential for what? Essential for. Do you know what? Have you ever heard about oxidative stress? When the free electron or oxygen attach to our cells, to our, for example, protein, we call that oxidative stress. Okay? The NADPH help the production of something under the name glutathione. Glutathione. Glutathione is neutralizing the oxidative stress. What is the oxidative stress? Some oxidant agent, oxidizing agent, guys. For example, whitening. Bleach. What do you say bleach in Arabic?
Bayo.
Cortex. For example, this substance is an oxidizing agent, and the patient with favism shouldn't smell these substances. Why? Because these oxidizing agents go to their body, and because of the absence of the enzyme, their body cannot actually tolerate this situation, and their red blood cells start to rupturing. Imagine this is red blood cell and this become ruptured. And what is happening? The hemoglobin are run out of the red blood cell and enter the blood circulation, and we will see the jaundice or Yaraghan. Okay? And this was the point that I want to know about the favism. If I ask you what is the favism, the reason of favism, you should know the G6PD deficiency. And you can search in your language to understand better, okay? I try to say all of the things, but I don't know.
Did you finish?
No?
That's enough for today.
We have a little time for starting. That's lipid metabolism a little.
We don't have energy. We don't have ATP. We need to go.
We should stay till 5 o'clock. What about
Doctor, you have enough time
عادي
tomorrow.
هتطلع منها في سبقوها للنص.
No,
اول مره اشوف كانت تريد تنقل المحاضره مش عارف.
لا انا اقول لك 10 دقائق خطيه تصير ونص.
يلا
10 مو بعض. والله خذتني عندها طاقه اكثر من عندنا.
Stand up, all of you.
شو اسوي؟
Stand up, stand up, stand up, stand up, have some stretch movement, have some stretch movement.
لا لا لا.
Just have some exercising, some
5 دقائق ما نبي.
energy.
من العشر. شوف الدكتوره.
Guys, what do you know about lipids? All of you wanna kill me, yeah? But someone say yes.
10 دقائق خلصت يا دكتوره احنا نطلع.
What do you know about lipids?
Some vitamins dissolve in lipids. They help to generate some heat, I think. They give you some of your body mass, like me.
Body muscle?
Mass.
Body mass.
That's all I can think of right now. They help you in generating energy by dissolving or being dissolved as heat, I think, or something like this. That's all I know.
And they are insulator, do you know?
Insulator for what?
For thermal insulator, electrical insulator, and mechanical insulator. Could you explain me? Thermal is obvious, yes?
Yes.
Thermal, it is actually save our body for temperature changing.
Yes.
What about electrical insulator?
So your electric signals don't go.
Yeah.
From where?
Transmitters from brain to muscles.
And what is the
Nerves.
the compartment that we call that it is made up of lipid? Have you ever heard about myelin sheath?
Yes.
Yes. They are composed of lipids and sphingolipids, sphingomyelin.
That's the first time I hear about.
Really?
I know the.
جابت الإشارة.
I didn't know the
Made
structure
of-
of.
Sphingomyelin. Dr. Khalili told you about sphingosine and sphingolipids.
No. Doctor, he was very, very basic.
Yeah.
Very few things.
He didn't go to the details.
And you were so lucky and happy. And you were all satisfied.
Yes.
And you don't think that you will be in a bad situation for your next session?
No.
No? I grab you and I catch you now. Okay, guys, we have something under the leg. It is so essential for your major knowing about myelin sheath. I think Persian and Arabic and English, everything is. What is this?
Nerves.
Nerve. Guys, the most important thing in nerve cell is myelin. If they become disrupted, what is happening?
We have slow
And the abnormality of that is
multiple sclerosis.
exactly MS or multiple sclerosis. We have another abnormality under Guillain-Barré syndrome. It's not important to you. About MS, the you should know about that because it was related to the lipid structure that you don't study. But it is important to know that it is electrical insulator.
For that reason, the electrical signal jump.
Exactly, they jump. We call them runway node.
Runway node.
Yeah, runway node. The electrical signal just jump here, and they accelerate the electrical impulses. I will tell you these subjects during this session, maybe till, I don't know, maybe till this part, in tomorrow, inshallah. Today, I think we can.
I think
Guys, about lipid, you told me that they are water insoluble. Am I right?
Yes.
They are compartmentalized. What does it mean? Can be freely in blood circulation.
No.
They should be in a special
Compartments.
structure. For example, in the cell membrane, in the mitochondrial membrane, in the adipose tissue, in the myelin sheath. They cannot be free in the blood circulation. And if they wanna enter the blood circulation, they should attach to albumin or lipoprotein. Do you know about the lipoprotein? Low density lipoprotein, LDL.
Like the carrier, I think.
Yes, they are the carrier of lipids.
Yes.
And I told you, as our friend mentioned, they are a good source of energy. Guys, do you know 1 gram carbohydrate and protein produce how much energy to us?
Doctor, but you said that it has a mechanical mechanism. What was it about? You didn't explain it.
About?
You said fat has thermal, electrical, and mechanical. You didn't say anything about the
Our abdomen area and about our organs. We have a lipid layer that
Like a
protection, yeah, protect. If we don't have this layer of lipid, despite the producing energy, our organs, for example, our intestine, our stomach, not in a mechanical protection. That's why in the situation that the patient go for liposuction, have you ever heard about liposuction and some
taking out lipids out of their body.
yeah, the adipose tissue is putting out the body for being slim. Yeah. These kind of surgeries may be hurt because of those mechanical insulation that the adipose tissue has. Okay, they will be in danger in different situations. Guys, 1 gram carbohydrate and protein produce 4 kilocalorie energy. While 1 gram lipid produce 9 kilocalorie energy. And another thing, how much was the glycogen storage in our body? How much was? I told you.
8 to 12 hours, you said?
And it was 1 kilogram. But in a normal person with 70 kilogram of weight, it has 10 to 12 kilogram of lipids. It is a good source of energy. And guys, the lipid metabolism imbalance lead to these abnormalities. Read them, please.
Arteriosclerosis, diabetes, obesity, fatty liver disease.
Have you ever heard all of them?
Yes.
All of them are familiar.
Yes.
Doctor, can you finish now? It's past 4:30.
That's